Now, we've got a very packed programme today, so you want to sort of move on. But just to say a few words about the subject areas we're going to be covering today. When Jane Mackenzie and I first began discussing this, back in April, wasn't it? Way before the general election, we didn't know what was to come. But we knew we wanted to talk about promoting health, obviously always very, very topical. And we knew we wanted to talk about that not just in the sense of the sort of individual health promotion to individual patients on a one-to-one basis, or even looking across populations, but we wanted to look at public health, promoting health, rather, in the very widest sense of the word as well, so looking at the societal influences, the environmental influences, etc. In other words, we wanted to sort of look at it against the backdrop of say, Michael Marmot's review about the wider determinants of health and the causes of ill health. So taking a very broad view, but also at the same time not forgetting that narrower view in terms of the individual and their individual lifestyles. So we wanted to look at that, and we wanted to work with as many partners as we could. And you'll see from today's sponsors and from the exhibition downstairs that we've taken that partnership approach very broadly. And in particular, we've made a real effort, and we're glad we did in the light of the way the coalition government is moving, to involve the commercial sector as well in all this, because I think increasingly we're going to be working with partners in the commercial sector. As we go through today, I'm sure we'll be talking about the ways of engaging the public, but that's just one of the 3 E's. I like to talk about 3 E's in terms of promoting health. I like to talk about E for engagement, engaging the public, getting their attention on an individual basis and on a population basis. But also a second E, which is a very important E, is how do we, as well as engaging the individual or the public, how do we empower them? So empowerment is a very important E, if you like, to this whole thing, because without the necessary life skills, the education that goes behind that, understanding the levers and buttons that can be pressed throughout life in order to make things, make a healthier life, without understanding that, and without having that empowerment, people won't achieve their fullest potential. And this present government does talk quite a lot about empowerment. But there's a third E, which I think is crucial too, and that does take us into these wider factors, and that's environment. So engagement, empowerment, environment, easy to remember. And the environment is not just the physical environment, but it's the social environment, it's the cultural environment, it's the fiscal environment, very, very important. It's the political environment. So I think it's worthwhile bearing all those things in mind. And of course, another approach is to think of those 3 E's being applied not just to individuals on the receiving end of this, but also to the professionals involved. Again, we have to engage, empower, and provide an environment for professionals to be able to do this work in their day-to-day settings, and the policymakers. They too have to be engaged, empowered, and have the right sort of environment in which to operate, to make the healthy decisions for the people they're responsible for. So all that, I'm sure, will come into today's discussion. The government's in the throes of putting together a public health white paper, which will be published, we think, by the end of the year, we hope. And that will talk about the introduction, as I'm sure many people here will know, of a new national public health service for England, along the lines that they have in other parts of the UK, and that will have a protection role, because it's like it's taking in the Health Protection Agency, but it'll also have a role with other domains of public health, such as health improvement, health promotion, if you like. The directors of public health will be based in local authorities. They'll be jointly appointed with the Public Health Service. Will they report to the chief executives of local authorities? I do hope so, but we'll wait to see. They will have ring-fenced budgets. How big are those budgets? What's in the budgets? What's not in the budgets? Big question marks around all that. And how well will the Public Health Service at local level and the DPH and team at local level link with the commissioning side, the NHS side of things, because you've got those 3 elements there, and how well will those cross-linkages be? They've got to work really well. There's talk of having these health and well-being boards, but how will those operate? What are the realities there? All that's still to be decided and being is currently being discussed about as we speak. So there are big seismic changes happening there in the way public health is going to be delivered, and we can get into some of that today. And of course, all this is against a background of these massive public sector cuts. I mean, the timing, you could argue about how wise the timing is, but the reality is that we've got these massive cuts, 20 billion pounds coming out of health over the next couple of years, and many billions more from education, from social care, from benefits, from housing, etc. So, what does all this mean for health promotion and for public health? And particularly, what does it mean for the notion of narrowing the gap in health inequalities? A lot of lip service is paid to narrowing the gap. If you look at any government document before the election and since the election, reducing health inequalities is always there in the first paragraph or two. But what are the chances of being able to achieve that against the sort of backdrop I've just been outlining? So we called this conference the challenges ahead. The challenges are huge, massive challenges. So many changes underway. But, we in the public health world are change junkies. We love change. We thrive on change. It energizes us. And within all these changes, or most of these changes, there are opportunities. And it's a question of grabbing those opportunities and doing what we can to help people, to help themselves to better health. And that's the kind of gist of today's conference. So we're going to have lots of very stimulating speakers, hopefully lots of good discussion as well. And I'd like to start off by introducing our first speaker this morning.